I'm Brahm Segal. I'm Chief of Infectious Diseases at Roswell Park. I'm also a professor of oncology and a member of the Department of Immunology. And my new title is Director of Faculty Development at Roswell Park. I work with a very talented group of people who work to apply best practice to prevent infections. There's a lot of exciting research going on at Roswell Park, and one of the things that I will help do is to mentor our junior faculty and to also try to stimulate collaborations between scientists, also between physicians and scientists to really develop team science here at Roswell Park. My area of research is in innate immune responses to infection and injury. And over the past number of years, we've applied that knowledge and experience to ask what are immune responses within the cancer microenvironment that could be useful to predict prognosis and also as targets for new therapies. I completed medical school at Albert Einstein College of Medicine in New York. I then did a residency training in internal medicine at Tufts New England Medical Center in Boston. I then did a fellowship in infectious diseases at the National Institutes of Health in Bethesda, Maryland. That was a research-intensive fellowship. So the first year and a half to 2 years was focused on clinical care, learning to be an infectious disease specialist, and then the remainder was focused on the lab, really acquiring a knowledge in inflammation. When I finished my fellowship, I was very interested in working at a major cancer center for a couple of reasons. First and foremost, I wanted to take care of patients who are immunocompromised, which means a low immune system, and that is what we see in patients who are receiving chemotherapy and stem cell transplantation. And also I wanted to build a lab, and initially my lab was very much focused on innate immune responses to infection and then to injury, but being a member of the Department of Immunology for all these years, I became very influenced by the really interesting and at times groundbreaking research performed by my colleagues. And I became more and more interested in tumor immunology, and specifically to ask the question, what are some of the immune responses that are stimulated by infection? Could they actually also occur in the cancer microenvironment? And if so, what are their roles in the tumor microenvironment? Are they good for the patient? Are they bad for the patient? And Roswell Park turned out to be a fantastic faculty career path. In fact, my only one. I've only been a faculty here at Roswell Park and UB for developing both my clinical practice and also my lab.